So I'm kind of excited. I've learned some new things today. And there's going to be some crossover from what I'm talking about and what we've already heard. I was concerned. I didn't really know what everyone else was going to be talking about. There'll be some crossover, but I kind of really like it because it's all weaving together and it's all making sense. And I think what I'm going to be presenting to you guys today is going to support what's already been said. Now you'll notice my presentation is called Spiritual Care and Self-Care for Healthcare Workers, but really it's kind of for anybody that lives in the world. Does that make sense? My flavor might go towards people who are, let's just say, still working. You could be working in the professional world, doesn't have to be healthcare, because I see a lot of similar themes in people in my own life that aren't just healthcare workers. My husband is a assistant CIO for a city. I shouldn't say where he works because he always like, don't tell anybody where I work. But let's just say a very high stress job. And I'm a nurse, a critical care nurse, and right now I work in academia. And I know a lot of physicians, I know a lot of people who work in healthcare. So, okay, my first slide here, I'm going to sound a little bit like a car salesman, right? What if I told you that investing 5 minutes a day could improve your work-life spiritual balance? Would you do it? Yeah. Thank you. See, the answer I heard was yes. 5 minutes a day, because I really think that when it comes to change and health, we have this feeling that if you don't do huge life-changing things, that nothing's going to change, right? I've struggled with weight pretty much my whole life. And when you think about it, when I've heard my whole life is, look, all you have to do is stop eating and then exercise. And I was like, well, I can't stop eating. And how much exercise? You know, all you have to do is change all of your lifestyle habits. Don't do anything that you enjoy. Don't ever eat a brownie again. And then you will lose weight and be happy. And so, not surprisingly, what haven't always been successful. But I think when we're talking about spiritual care, taking care of ourselves, it's really not as daunting as that. That really you can take 5 minutes. And we're going to do some exercises here together. And I hope that we're all going to be up for it. Being a critical care nurse and an educator, I've been trained and educated a lot about different ways that people learn. So as much as I can put a hands-on spin to something, that's what I like to do. All right, so that is kind of my takeaway. If you leave today, not just based on what I'm going to talk about, but if you can take one skill and say, I can do this one thing for 5 minutes a day, I really do believe it can be life-changing. And I think anybody can do something for 5 minutes. Okay. So my spiritual journey, I'm going to call it, kind of began a long time ago. And even as a teenager, I was always a very spiritual person. I remember being on my soccer team in high school, and I was in charge of saying the prayer. We always said a prayer before every game. I don't remember how I became the person to say the prayer, but I think that I always just enjoyed looking at the spiritual side of life. So I would say that prayer before every soccer game, that we would all be healthy and no one would get injured. And I really loved that. I loved that I was like the spiritual soccer player. And then when I first became a nurse, I remember being about 21 years old, and I had a patient who was actively dying. So a 21-year-old, I don't know, you don't know a lot at 21. I had never been around a dying patient. You know, and there's only so much training you can do, which for me, I think it was really not much because we didn't talk a lot about dying. But I was like, well, you're a nurse, you're probably going to see it. It's probably going to happen, and you're going to be the person kind of in charge of something, whether it's comforting the patient, making it a more, you know, a calmer kind of a passing. You're going to have family members that are anxious. And I just remember that I didn't know what I was doing. I was very stressed, but I thought, well, this is a wave, and I'm just going to ride it with this family member. Okay, so it was a mother, and her daughter was there. And she had pretty much known that her mom was going to be dying. And I was like, well, what am I supposed to do? So I just was kind of present, making sure that the patient was comfortable, and just kind of took this journey with her. And it was this amazing experience because of where I worked. We were actually overlooking the ocean. We were in Scripps Clinic in San Diego. So the whole side of the building faces the ocean, if you ever go to Scripps Green Hospital, okay? So I just remember this lady taking her last breath right as the sun went down. It was like the most perfectly timed thing, and I was like, this is God. This is God. It was so beautiful. I mean, sad, yes, but it was so beautiful that I knew right then that my job there, I was given this gift to be with this patient as they would pass on. And I also realized, as stressful it could be to be in this situation, it was a spiritual journey that a patient was going to go on with their family. And sometimes there are no family members when someone is dying. That's another separate journey. But I decided to take my mindset that, wow, what an honor, not a burden. A lot of nurses I work with, they're like, if you came in, they're like, the patient in bed 7 is going to die. They don't want bed 7 because there's going to be tears and crying. It's going to be, right, dramatic. It could be draining. And I was always up for it. I was like, no, they're going on their journey. I said, you come into this world one way, most of us in a hospital, and as a nurse, there are nurses who bring life in. And I said, I'm honored to be a nurse that can help life go the other way, the crossing over, if you will. So that was my mindset. I try to teach my students, because I teach nursing students, and we have death and dying. We do a simulation, right? So now it's 2025. We have a lot of great technology. We have mannequins, and they can blink and sweat, and we write these highfalutin kinds of scenarios, and we have the nursing student take care of the patient. And I always just try to say, remember, this is an honor. This is an honor to be here. And if you look at it that way, these experiences will feed your soul. So I knew right then that the way to avoid burnout, because we heard about burnout, right? We didn't really have it as much in the 90s as nurses, because let's be honest, insurance companies didn't really start running things till the 90s. Hospitals didn't really become businesses when I first came into nursing. So people could come to the hospital and have a hysterectomy and stay a week and walk around, and and they were nice, they were happy, and I could make everyone's beds, and we could chat, I could educate my patients. And now pretty much the patients that come in the hospital are very sick. They have so many comorbidities, so many different psychosocial issues, that they're the nice kind of, I don't mean to be flippant, kind of the nice, normal, healthy people aren't in the hospital. Does that make sense? I have a friend who was a nursing instructor this summer. I'm not kidding you. She had both of her knees replaced. Different. One day. She left from the recovery room. The recovery room. I kept those patients for 5 days and helped them with physical therapy and ambulated one. Literally, they're like, yeah, they have physical therapy, come in the recovery room, and then they make sure you can take 5 or 6 steps. And then they're like, okay, you're good, get out. And then she did the same thing again 6 weeks later. So now she looks like one of those Frankenstein dolls, like huge incisions, both of her knees. And then on top of it all, she developed skin cancer on her scalp. So they had to cut out a big chunk of her scalp. So she's walking around like the most wounded person I've ever seen. But I mean, the changes in healthcare, right? The changes in healthcare were great. So starting to learn that, I knew that I wanted my career to feed me, not just I have to feed and give to this career. How could I have my career feed me? Okay, because there's a couple different mindsets. Okay, let me see. I tried to put the slide forward. Okay. Well, I need the guy. I know there's something I'm supposed to be doing here. Tammy Tammy is the guy. But she's so much more than that. Is it on? You know what? That is always such a great question. Is it turned on or something? What'd you say? Yeah, wait. You had to push something. On the computer to get it. Oh, yeah. Okay, so I pressed the, okay, it worked a minute ago.
Jessica, if you can hear us as you're taping, can you find the guy?
There's a guy, Jessica. We need this guy, stat. I feel like I'm talking to the, someone in the clouds. This is kind of fun. Well,
Oh,
we're
wait,
gonna-
here's a play.
Oh, wait, there's a play button.
No. Okay, so,
No worries. I'm gonna keep,
tell Joe.
okay, I'm gonna keep talking. But I kind of wanted to see my next picture because it's really nice. Dang it.
Wait, what if we did some breathing exercise? Because your anxiety and stress is going up.
Yeah, let's breathe. Yeah. This is good, yeah. So this is, we are gonna do some breathing exercises.
This is teamwork right here.
Oh, I got it.
Is it over here?
Yeah, I'm sorry. I did try it earlier.
Okay.
Oh,
You have to click on it.
what did you click on?
You just have to click on the slide with just like a mouse. It's like a mouse. This is like your
Okay.
mouse.
Thank you.
Have you got it?
Okay, thank you.
Okay.
Thank you so much. Perfect.
Yep.
Okay, there we go. So yes, I kind of already been talking about myself. So I began as a fresh-faced 21-year-old. I worked as a med-surg nurse for 5 years, moving into critical care for the last, I really have about 25, 30 years experience in critical care. And then in 2009, I began teaching in clinicals. Someone had said, you're really good with the new grads. You're very engaged. What do you think about teaching? Do you want to try it? Literally, that was my introduction. Do you want to try it? Because we need somebody to take these students over at Modern Health. I had no idea. I really didn't know what I was doing, but I've always been kind of a yes person in my life. Now, often being a yes person can come with many. Sometimes I say yes and I just go, I don't know why I said yes. Why did I say yes? But this was actually a beautiful opportunity that I took. And so I just showed up one day with very little training and they said, here are your 10 students. 2 are going to be in this ICU, 2 are going to be here, 2 are going to the emergency room. You just need to make sure they don't kill anybody. No. I mean, that's kind of what they said, just make sure they don't do anything stupid. And I said, okay. And I ran around the hospital for 12 hours and talked to them and they gave medications and we had conversations about patients. And I was like, this is kind of fun. This is actually kind of fun. So then I realized I wanted to maybe go into education. So I taught clinicals for many years. I worked on my master's degree. I got that in 2009. And then I realized if I wanted to be a full-time professor, I would need a doctorate degree. And I wanted to get kind of the most challenging I could, getting a PhD in nursing and healthcare and innovation from ASU, and that took about 5 years. 5 years, and it probably took about 20 years of my life mentally, and that was okay though. That was okay because I knew that this is what I wanted to do. I wanted to do it as well as I could do it. Okay, now we're gonna try another slide. Nope. Here we go. So my talk and what I focus on healthcare worker burnout, but really, I think anybody can be burned out. Does that make sense? Now, I know there might be folks here who are like, hey, I'm retired. I'm as happy as a clam and clam soup. And I don't have any of that. Right? A lot of folks that I meet now that are retired are so happy. They are so happy. And I say, can I feel that way too? But I can have that benefit of still sort of loving what I do fundamentally. Does that make sense? So I do like going to work even though people have changed. Does anybody know what I mean? People have changed. I think sometimes the inquisitive nature of people that want to be there and want to learn, and I'm like, don't you want to be a great nurse? Don't you just want to go in there and take care of people? I'm so passionate for it. When people don't have any passion for it, it hurts my heart. Because they're like, no, I just want the money. Can I just have the money part? Not everybody, but there is a lot of that. So, when you're going to go into healthcare as a profession, other people are relying on you. Did anybody here go to Dr. Tina's talk? And she talks about her daughter being in the hospital for 5 months and a few of her setbacks being related to errors. Okay, and nobody sets out to hurt anybody. However, you can. If you're not competent in what you're doing, you can hurt another person, not meaning to, and I strongly believe that I, as an instructor, have a moral obligation to make sure that I'm preparing those students that I put forth. They're gonna be the most prepared to go out there and take care of other humans. All right, so let's talk about burnout. So I started doing some research about stress and burnout. And I uncovered in the last 2 decades, like the number of articles that have been written have been increased by 6-fold. And in the last 3 years, even a more rapid rise. And I think a lot of these articles and studies probably did come out of the COVID, right? Everything that happened during COVID. I actually went back to the bedside during COVID. I was the only person that I knew who did that. Most people ran away from the patients, understandably, because many of them died. But I sort of decided because they wanted us to teach online as nurses. They wouldn't let us go to the hospitals. They wouldn't let us be in person. And I just couldn't do it. I just couldn't do that. So I said, what am I gonna do? Well, you're still a nurse. Go back and take care of the patients. So that's what I did. So there have been a lot of articles written about burnout. Even though I think burnout in a work-related sense, I think it's been there for a while. We've been heading down this road for a while. So the classic definition of burnout, there's a Dr. Christina Maslach. She's states it's a psychological syndrome involving emotional exhaustion, depersonalization, a diminished sense of personal accomplishment. So similar to other psychological syndromes, burnout subsequently affects cognitive processing. It colors how you process and interact in your everyday world. And I have, I think, some good examples for that from my own personal life. Recent data, are there any physicians in here at all? Maybe not, okay. Recent data suggests that the mean prevalence of physician burnout in the United States is between 40 and 50% in the United States. And then nurses are not far behind. We're at about 35 to 45%. So actually our physician burnout rate is about 2 to 3 times greater than other countries. Now, this is gonna talk about burnout of physicians, but your mind can go, why do you think that is? What is happening in this healthcare world that is causing the people that are working in healthcare? It's not just physicians and nurses. I know respiratory therapists and physical therapists, lots of different people that kind of suffering the same thing with burnout. And there are even studies that talk about how nurses, after 1 year of nursing, they do a study which asks nurses what's their intent to leave the profession. It's pretty high. What I find is they don't necessarily leave the profession because they have a license, but they go to a less stressful area, right? So maybe they work telemedicine, maybe they're gonna work for insurance companies, maybe they go into sales, but the people in the hospitals taking care of the sickest people, those people aren't sticking around. Okay, so what happens is now you have a hospital that is sort of run by novices. So people with less than 2 years of experience. So I definitely found that in COVID. So I came in with 25 years of experience. Most of the people that I worked with were 1 year, maybe not even that. In COVID, they were so short of nurses, they didn't even have to have experience to get a job. So the people like me that were 25 years in, there really wasn't another person with my experience level. There might be a couple people with 5 or maybe 10, but for the most part, you're running a whole unit, right? With people that don't have the experiential knowledge that you would hope that they would have. So that I found this great model, the job demands resource model. And once again, this can be used when we look at it, conceptualized for sort of any career. It's a well-known framework in occupational health psychology, explains how different aspects of a job can influence your well-being, your motivation, and your performance. So basically, you've got two sort of wide components. You've got job demands and job resources. So job demands, which is work overload, role ambiguity. What am I supposed to be doing? Oh, I have work overload there twice. Emotional strain, role conflict, physically demanding tasks. We had all of that in nursing, working in an intensive care unit. So when the job demands go up and your resources, which are supportive leadership, supportive coworkers, autonomy and decision-making, opportunities for learning and development, recognition, feedback, adequate staffing and equipment. So when job demands go up and resources go down, I've got this arrow and I was like, where is your arrow hitting to? It's burnout. Sorry about the banging. Basically, that's what leads to burnout. Too many job demands, not enough resources. So if I were in charge of, let's say, a nursing unit now, I'd probably want to do some kind of an inventory, the MASLAC burnout inventory, which is a survey, and it was designed for healthcare, but it can be educators. There's a whole wide range of these surveys that are created for different jobs. And it basically gives you a number and it measures emotional exhaustion. How much are people feeling drained, overextended, fatigued by their work, depersonalization, and cynicism, those go together, where people develop a detached, callous, or negative attitude towards their patients, colleagues, or work. Well, I've seen that a lot. And that's when I know someone's really burning out, is when they just have lost their ability to be empathetic towards the patients and maybe make callous comments about, anything, maybe their size, maybe their behaviors, maybe we have a lot of homeless patients, a lot of people with drug addictions, a lot of people with alcohol addictions. A lot of these things come in and they're not the easiest people to deal with. So you take someone with a lot of issues and then make them sick. And do you think they're delightful? They are not delightful, and you are the first person in that line of fire, right? So you can become very cynical. And one of the ways you can kind of deal with your cynicism is sort of mocking or maybe making fun kind of behind the scenes. I see it a lot now in social media. I've actually stopped following some of the big nurse people, Nurse Blake, Nurse John, because they would make these videos that were meant to be humorous, okay? But at the end of the day, what I saw was you're making fun of the patients, right? You're making fun of the patients, the old lady with dementia who sees something on the walls, or a man who pulled out his Foley catheter. And even though once in a while I can appreciate that, I'm like, you're taking my whole profession that I'm proud of. You've kind of making a mockery out of it, in my opinion. But people really bond and feel like, oh, they understand what it's like to work in these settings and with the different demands. And then I found the negativity just became too overwhelming. So I don't actually follow those kinds of personalities, if you will. Anyways, okay, so what else? Personal accomplishment, a sense of competence and achievement at work. So one of the items in the MASLAC is, I feel I'm positively influencing people through my work. If you don't feel like you're making a difference or having positive impact, and you're just going to work because you have to, because you need money, well, we all need money. I think most of us need money. Anybody here not need money, raise your hand. I'm just kidding. So if you're only going to this job for money, my belief, if you don't like it, you don't like people, enjoy people, feel a sense of helping someone through a hard time, it's not going to be a fun career. You're not going to have a good time at all if you don't find these situations challenging. And once again, that contributes to burnout. So what are some of the effects of burnout? Well, job dissatisfaction, poor sleep. Didn't we talk about it with Dr. What was his name? I've already forgotten. Dr. Anderson talked about sleep, and that affects your own personal relationships. So you may think you can bubble in your work life, keep it in a bubble, and then come home and you're fine, but you know what, you're not. You're a jerk. Maybe you're not a jerk. How many physicians have I known who were divorced? Very high divorce rates, right? Because you go somewhere and you work a lot, maybe you're in a special area, you work 20 hours a day, you know, and then you come home and you have nothing left to give a partner or a relationship. So yes, burnout will affect your personal relationships. And once again, as we talked about in the other sessions, depression, suicide, and overall lower lifespans. Doesn't it sound great? And why do we do this? Well, we do it because we think if we can build up the things, we can just have enough stuff. I just have enough money, if I have a big enough house, right? If I have a nice enough car, if I can just have all the things that I want, everything's going to be fine. But it's not. It's not. The stuff isn't what makes us happy. All right, so we're talking about our burnout. All right, so now we're gonna do a little activity. Everybody's got a pen in their bag, or Miss Tammy can help us. So I know that not everybody is working in a healthcare setting. But is our ministry? Well, ministry is, you're working with the public. Caregiving. Right? You're caregivers. Exactly. So I want you to look at this survey and answer some of these questions. Answer all the questions, and I want to talk about it, kind of check in and see if you're willing to share where you were at. So what you're gonna do is you're just gonna circle like section A, stress. So there's a 1 through 6. You pick one of these numbers. Does that make sense? So in section A, you're gonna pick 1, in section B, you're gonna pick 1, and then we're gonna add up those numbers. We're gonna see where we are. In fact, Tam, I want you to do 1, I'm gonna do 1. Okay, let's do a little check-in.
So do we put a number by each number or?
Oh, I'm sorry, you know what, I apologize. I gave you the wrong instruction. So section A, stress. I feel I'm unable to control the important things in my life. You're either gonna click it's either a 0, which is never, or a 4, which is always.
So put it next to it.
Yes, so put it right next to it. Give a number to each question. I apologize for that. And go ahead if you wouldn't mind completing the optional reflection questions. How are we doing, guys? You got something down there? Pretty good. All right, so we have 2 sections, right? A and B. I told him my score and I got a 16. So let's look at the scoring. 0 to 6 is considered overall score. If you were 0 to 6 is considered low. Anybody here 0 to 6? Nice, good. That's a great place to be. How about a 7 to 12? Tammy, okay, 7 to 12. All right, 7 to 12. I was a 16. 13 to 18, anybody between 13 and 18? A lot of people. Anybody here 19 or greater? Okay. Good, so a lot of 13 to 18s. So 0 to 6 was considered low, 7 to 12 moderate, 13 to 18 high, 19 to 24 very high. So I know that a lot of this is really related to healthcare worker, but I think it's a good check-in. So interestingly for me, my stress level was a 13, but my burnout level was a 3. Isn't that interesting? Did anybody have a higher stress level than 13? Or did anybody have like a discrepancy? Because you would kind of think stress level equals burnout. Tammy.
My burnout was a 1,
Tammy's burnout was a 1.
stress was 12.
And her stress was a 12. So if you really look at the items, you know, and maybe you guys are willing to share, like, have a difficulty relaxing after work. I really do. It's probably because I drink caffeine throughout the day, as we talked about earlier, right? And that's not a good plan. I feel easily annoyed or irritable. After a day, 8 hours with Block 1 nursing students, I would be lying to you if I said I did not feel annoyed or irritable. And I'm not gonna lie to you guys. I feel tense or on edge, I picked a 2. Emotionally drained, so for me, I feel like this is kind of telling me my stress level is high. However, what I have going for me is that I love my job. So when it asks, I feel I'm not making a difference through my work, that's a 0. I know I'm making a difference. I know what I'm doing is helping cultivate the next generation of nurses. I feel emotionally numb when dealing with patients or coworkers. No, I would say I never feel emotionally numb. I feel less effective at my job than I used to. No, I actually feel very effective. Does that make sense? So it's not kind of a one-shot thing. So I feel like that might mean I'm able to modulate my stress. And we'll talk about that. I'm able to deal with the stress. So if I felt detached or disconnected from people, if I felt less effective and emotionally numb, if those numbers were higher, I'd definitely say, yeah, I'm burned out. But I'm not burned out. There's always gonna be stress involved with my job. Does that make sense? The question is, are you going to let that rule how you feel and how your life is? Or are you gonna figure out ways to manage it? Tam.
This is really interesting because first of all, learning the difference between anxiety and stress, that was big for me because
Yeah.
I don't have anxiety, I have a lot of stress, you know? But I think as someone who has a ministry heart, and I think everyone in here does some kind of caregiving or chaplaincy or, ministry work or volunteer, is how do we not get to that burnout? Because I think we do have passion behind what we're doing. But then how do we manage the stress in a world that just keeps pouring it on and overstimulating and telling you what's right and wrong and keeping, we have to fight every day to be the calm in the storm of not only our own lives, but other people's lives. So I think this is great, a great awareness because, I've never seen it like this before, written down, where it's just such a polarization.
Well, I think
Really cool.
it's helping me check in to realize that, yes, I'm feeling a lot of stress and I think I'm doing great things to mitigate, but we'll talk about interventions. Did anything here surprise you when you looked at it? Where you were like, well, this is saying that I'm burned out, but I don't think I'm burned out, or this says I have stress, but I don't think I have stress, or are you guys kind of landing where you think you would land? Pretty much. Okay. So I think, for me, it's kind of giving me hope. I feel exhausted when I think about facing another day at work. Sometimes I do. I would be lying if I said, because we do like 8-hour days with our nursing students, okay, in a lab setting. So I have block 1. So they're brand new baby, not even nurses, right? So you're really trying to help them from the very, very beginning of time. The very, very beginning. And so for me, what I've realized as being an instructor is that I also want to work with students who are more advanced because it's a different dynamic. Does that make sense? Students who are more advanced and not as needy, and they've learned the rules and they understand how to be a good student, a successful student. They've learned they have to take accountability for their own actions. All of those things, once they've been developed, it's a whole nother experience, right? So when you work in ministry, I'm always kind of in awe. Because truly, in ministry, kind of like being an emergency room nurse, you don't know who's gonna walk into your office, or you don't know who you're gonna see that day, right? And so given the state of, I think, kind of mental health, we have a lot of folks that are really suffering and struggling. So you're not just a spiritual mentor, you also have to be very knowledgeable, right? Be really knowledgeable about, I think, mental health concerns, substance abuse, all those kinds of things. I love Tammy, the story that you told. I think it was Pastor Mark when somebody came in with a gun and he had just had his wisdom teeth out. He had just had his teeth. Do you remember that? Yeah. Why don't you tell the story?
Okay, so I don't know if I'm telling all the facts right, but around, he just had surgery and he was still a priest and he walks into the rectory into where he was living. and there was a guy that had a gun. And he wanted to kill himself, shoot him, kill himself, but he was all upset, and he was so on medication still. And he was like, okay, listen, I just can't do this right now. I just had surgery. I want you to be okay, and but can we just put the gun down and talk about this, and maybe we can reconvene later? It was just natural for him to just, okay, it's all gonna be okay, let's just sit down, I can't handle this right now, so. It was just, yeah, it was really cute, like, of course, he picked up at the mode of caregiving and making sure he was okay, but he just went into this whole, dude, I just had surgery, this isn't gonna work for me.
I'd see you in for next week.
That's what they called the cops and everything was fine, but yeah.
It's fun working at a church hearing all these stuff.
I mean, when that's your world, your workaday world, and you feel comfortable doing that, that's what blew me away, that he was just like, oh, for gosh sakes. Didn't the guy also apologize to him? The guy was like, oh, I'm sorry, so, I'm so sorry, like to me, it sounded like a Saturday Night Live skit.
Monty Python.
And fortunately, it went well for him, but I mean, can you just imagine the mental, emotional kind of the burden and the workload when someone comes in and they're like, I'm gonna end everything, that's just a lot, right? That is a lot. So what are we gonna do about burnout? What are we gonna do? How do we combat burnout? So the first thing we can do is deliberately increase positive emotions to counteract the flood of negative emotions that accompany burnout. And I was thinking about the whole turning off social media and the whole feed. You get stuck in the feed and you scroll, and I'm addicted to right now. I really have to cut myself off. I think I need an intervention because I'm realizing that I'm doing it too. I'm doing the very thing that I'm so critical of. Right? I'm doing the very thing. So just as depression and anxiety have been linked to lower levels of positive emotions, the same has been found for burnout. So there's research that consistently shown that experiencing positive emotion is a causal link in a chain of feeling greater purpose, which is I think why Tammy and myself had lower scores of the burnout part, because we really do embrace the purpose of what we're doing. And that's why we're not completely insane right now. Well, I need to only speak for myself, right? So positive emotions like hope, they serve to effectively recharge our depleted batteries. So the second group of strategies we've heard about it today, developing mindfulness and other reflective activities such as prayer. And then thirdly, strategies that enhance your sense of purpose and meaning in your work. So that really is also, I think, some mindset work. Sorry about that. All right, so what can we actually do? As a critical care nurse, I'm really big on what's the intervention, doctor? What's the order? What do you want me to do? What do we need to do? And I love this quote, the negative screams at you, but the positive only whispers.
Yes. That's 2009, huh?
And I want to give that proper quoting,
So good.
but I do have that somewhere. I'm sorry, I didn't have it on my paper, but what's that?
Oh, it's on your slide.
Oh, it's on my slide. There you go, 30%. And I love that because in this world of social media and all of the things going on, that's exactly what happens. Everybody's yelling at us.
I just heard that the other day for the first time.
Did you?
Yeah, it was like, you guys, you won't compete with the nonsense.
Yeah.
But which gently whispers, you have to quiet yourself to hear him.
Yes.
And you better be mindful enough to say, hey, I'm missing out on something if I don't hear the clutter.
So I'm actually gonna put this up in my house. I live with my husband and two of my daughters. This is gonna go up somewhere we can all see. So let me just give you an example, and I'm keeping my eye on time, guys. So let me give you an example from my personal life. Paul and Hannah would be mortified if they knew I was talking about this, so.
We're using their names, so we'll pretend we didn't hear.
Oh,
that.
yeah.
Okay. Listen, they live with me, they know it kind of comes with the territory. So my daughter has struggled with anxiety, let's just say anxiety. Probably obsessive compulsive disorder, depression. Pretty much her whole life. She pretty much came out of the womb. I don't know if anyone remembers having children or having young children, and they have personalities. They come out of the womb, sorry, I didn't mean to go like that, but they come out of the womb and there she was, a ball full of anxiety. What's going on? Why am I, this is terrible, I'm out here, I even remember my mom saying, oh my gosh, she's so alert. She was so alert and awakened, but the anxiety was always kind of there. And when you go through childhood, you're able to they have their schedules, you're able to manage things. We've had ebbs and flows, and maybe we go to the doctor, we go to a psychiatrist, and they said, try these meds. And I'm like, no, I'm not putting my daughter on lithium. Bye-bye now. So yes, so you try to do things, and then they don't work, and then things are going good for a while. I don't know if anyone has family members that have mental health struggles, right? So it's up and down, but I would say for the last 5 to 6 years, we kind of hit a terrible sort of just a downward, not a terrible downward. And we don't have drugs and alcohol, but definitely sort of stopped her in her tracks from progressing in life. Does that make sense? So anyways, this has been 5 or 6 years. So finally we tried a different medication, seemed to be helping, and she's like, okay, I'm gonna get a better job. A job with more potential, something we've been wanting for a while. And so she got this phone call. And she had gone on this interview. And I try to keep my hopes. I try not to get too excited, right? Because the disappointment can be that. So she had gone on this interview, and it was at a law office. She has a degree in business law. I mean, she's very bright and very capable. And so she goes, well, she goes, I don't want you to freak out. And I'm thinking, why is she saying that? Me freak out? Well, I'll show you what she said. She goes, I don't want you to freak out, but they offered me the job. And I literally, she's like, no, don't freak out. And I said that. I said, I have to do something. Here was my job. I was so happy. I was like a dog, and I ran and I did zoomies. I ran around the house like this. And she looks at me. And I kept running. She's like, what are you doing? I said, I don't know. I said, I'm so happy right now. I just need to run around the house. And so she let me run around the house like an idiot. I didn't care. I didn't care how much the money was. I didn't care. None of that. I felt so much joy and gratitude. I was, God, thank you, God. You have answered my prayers. I just wanted her to have a chance. I was so happy. I was so happy. Okay, gratitude. I didn't ask her, how much do you make? What is this? What is that? I didn't care. I didn't care. It's a job, a full-time job in an area where she could have some growth and some potential. So I'm so excited. And then she had called my husband to tell him, God, such a Debbie Downer. He didn't do that to her, but he says to me, well, this is just talking about mindset and gratitude and burnout. He is so burned out in his life and his job. He went to the negative. The negative screams, the positive whispers. Well, it's not that, the money's not really that much. And, well, we don't know, is it gonna have benefits? And she's gonna be working with, criminals or whatever I don't know what he's saying. It's like a law office. I'm like, so what? We all work with criminals. I could be a criminal, you might not even know. Did you ever do a background check on me? 33 years, you don't know. I could be a criminal. My point is, I went for joy because it was such a huge, momentous moment. I said, even if this is a SHI show, she's gonna have an opportunity to learn. And that's what I told her. You're there to learn. You are a novice. You are there to learn. You are not there to demand anything. This is the other thing I hate about I don't hate about younger people. But younger people feel kind of entitled. I am gonna be a nurse for 1 year and then I wanna make $50 an hour. And I go shut up and take your seat. You need to earn it. Okay? I said, you're there to learn. And I said, if it's horrible and terrible, you'll be fine. You'll be fine. So he went to the other place, right? I'm like, are you happy? Why there's no happiness in your voice. Where is your happiness? It's burnout. He is so burned out from his job, very hard for him to see the positive. Does that make sense? And that really stuck with me. He goes, and I go, listen, we have to be positive about this. You can't be saying things like, well, how much money are you gonna make? And what about, you can't say any of that to her because she will spiral out of control. We're gonna be happy. we are gonna be the happiest people that we ever met. And I said, if you can't be happy, I need you to at least keep your mouth shut. Okay, this has been, Tammy knows. Tammy knows, Tammy and I are good friends. Anyway, so that was just a great example. I'm like, I'm talking about that in my little talk. I'm gonna talk about it. But you know what? It's fair that I called him out because he works for the city and when they have these red light cameras on the freeways, you guys remember that? Okay, so he used me as an example to all of city management and everybody in the world when I ran 3 red light cameras on the 60, 30 seconds in between. I did 3 of them in a row and he was giving a presentation to the city. And he goes, well, here's a driver who has caused the camera to go off 3 times. And they were like, oh, well, that's not very nice. He goes, okay, it's just my wife. Okay, so he called me out. So I feel like,
Yeah.
you know, this is,
Yeah.
all is fair, right? This is fair, you know, you're gonna, okay, I can do that too, sir. I can do that to you as well.
Now, serious legal question, isn't that really one incident, just because it was?
Well, Sir, that was my point. I said, listen, I was late to work. The camera went off the one time. I'm already caught. I'm gonna catch the next one, then I'm gonna catch the next one. It's just gonna be a whole flow. I said, do I really have to pay for 3 separate speeding tickets? This is unconstitutional, which I don't know if it is or not, but I was getting high on my legal horse, which I have no knowledge. I go, this is wrong. I need you to go to the city mayor and the governor, and I need you to go to the people and tell them this is wrong. He's like,
And pay you for.
he's like, oh my God, whatever. He's like, whatever, calm down. But you know what, those cameras did go away.
Yeah.
If anybody lives in East Mesa. Cause I'm like, that's gonna make things worse. Right?
I too was one of them, remember?
Tammy,
I think I got 8 tickets in like a month.
Tammy got 8 tickets in a month. And I'm sure they were like, this is great revenue.
Public safety, no, revenue, yes.
Anyways, okay, so yes, I called Paul out and I'm sorry for that, but you know what?
Oh, no, go back because of gratitude.
Gratitude. Gratitude. So that was my other example, like I said, my level of happiness in that moment, I was like, you know what, I gotta stay with gratitude. I have to stay with that. But it is so easy. It's so easy to start picking something apart, really anything, isn't it? To pick anything apart and look at the negative. Any situation, even if it's a terrible situation, what I've decided I'm gonna do. So I struggle with some of my students, I've shared that with you. But what I'm trying to do now, so I have one student who is repeating, I had her last semester. And my partner said, well, check-offs went terribly. They don't know how to do this, and they didn't do that right. I'm like, okay. But she goes, but you know who did great? And then she said the little girl's name. And I didn't think this girl was gonna do great. But she did. She did great. So she learned, she's improving. And then I took that little nugget. And made that my gratitude piece for the day. I made that my gratitude piece. So when I go home and my kids say, how was work? How are the students? Are you being nice to your students? That's what one of my dog, Caitlin, asked me. Are you nice to them? I'm like, of course I am. Now, shut up and eat your spaghetti. I'm as nice to them as I'm as nice to you. And she goes, oh, no. But then I was like, oh my gosh, Brayden, oh, you know, you guys don't know, she nailed it. She did so great, you know? So I had 20 students who I wanted to, you know, I wanted to have a moment, but then I found my moment of gratitude. And that's what I'm trying to do now, be more purposeful about that for myself. So I know I think Dr. Tina talked about prayer. I think it's been talked about. But this is one of those, the power of prayer. The power of prayer. I really think it's amazing. And I was like, you know, there are so many resources now. In my research, I found this great article and it had, I don't remember the college. If anybody wants to know it, they want to email me, they can, but you can literally for free download these apps. And every day I started to do it, they would send me a text and they're like, it's time for your 3 minutes of mindfulness. So the text would come up and I would go through and do my prayer. All of these are free, wonderful. And I thought, you know what? I want to say a prayer before I go to work. Cause I found that that helps center me. And sometimes I'm a late person. I kind of tend to run late and then stress out. And then I'm on the freeway and I'm driving really fast and I'm listening to, Billy Joel. We didn't start the fire. So I listen to music that gets me all hopped up instead of my Native American flute. So yes, I found a couple great prayers. And I'm going to make prayer cards. I remember when I was working during COVID, we had a great chaplain where I worked, and we became very close, Chaplain Kevin. And I loved being his point of contact. And every day, because I would be in charge, he would come to me and say, Mari, who are you worried about? And we'd go down my list. Oh, this person, they don't have any family. This person has this going on. We just would kind of touch it on points so I could help direct him. Who really needs Chaplain Kevin today? And I loved it. That was my favorite part of that job, was collaborating with Chaplain Kevin. Because I found in the midst of kind of hopelessness, which is what we all kind of felt going through COVID at some point, what can I do for these patients? I could bring Chaplain Kevin. And what he did was as transformative as any medicine that was available. So that was really a great, beautiful thing. So the power of prayer. Oops, did I turn myself off? Okay. The power of prayer is so amazing. So I've decided that I'm going to begin and end my day with a prayer. I'm going to use the app, one of the apps that I found. There's so many great things you can do, and incorporate gratitude. I've also decided that at the end of every day, no matter what's happened, I want to take one focal point and call it my gratitude moment for whatever happened that day, my gratitude moment. So there's so many ways, prayer walks, you can take walks, you can whisper short prayers. And I do that a lot. Lord, help me be patient or guide me in this moment. Creating a prayer circle at work or church or with friends. I had a student last semester and he was great. He would say before a test, he walked up, he says, can I invite people to come outside the classroom and pray with me before the test? I said, absolutely. So he would do that. He would get up and say, if anybody would like to pray with me, I'm going to step out into the hallway and say a prayer before the test. So it was a wonderful, beautiful thing that I encouraged for my students. Oh my gosh, I'm actually not going to get through all my stuff, which is not a terrible thing. All right, so we're either going to do 3 good things or we're going to do a breath work. You know what? We're going to do the breath work. I just want to share with you something called 3 good things that you can do maybe tonight. And it's based off the work of Seligman. And all it is you write down 3 good things that happened today or yesterday and the cause. Okay, so you've got your little books that you got from the conference today. So a recent study with healthcare workers demonstrated that 15 days of 3 good things resulted in reduced emotional exhaustion and depression, improved happiness at 1 month, 6 months, and 12 months, and improved work-life balance. So really, how hard would it be to take your little book and have it by your bedside and write down 3 good things? 3 good things that happened. Once again, shifting your mind away from the chaos and towards the positive. But I want to end us with a quick 3-minute, 4-minute activity of breath work. So I know that that we talked about breath work today, and there are so many benefits of this intentional practice of controlling and regulating your breathing to improve your physical, mental, spiritual health. It reduces stress and anxiety, improves your mood, enhances your mental focus. And I thought we could just do this just for a couple minutes. It's shown to lower your blood pressure, your heart rate, improve your sleep, enhance your immunity, better digestion. It's amazing. So what we're going to do, we are going to do and box breathing.